Otolaryngology head and neck surgery at the St. Luke's Medical Center, Global City. You may join our discussion by calling our hotline at 548-4678.
Standby na po.
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
At the onset, throat cancer may be difficult to detect.
When you say throat cancer, it's an abnormal growth in the throat area. It could mean that the cancer is growing either on the tonsils or the tongue or the lower pharynx or the larynx itself, the voice box.
This type of cancer can originate from your larynx or voice box, thyroid gland, and food pipe.
The initial symptoms would be hoarseness. So we always mention to our patients that if you have been hoarse for 2 weeks or more, you need to make a consultation with your ENT.
But there are many other red flags out there, such as difficulty in breathing, sudden weight loss, relentless coughing, and bleeding of the mouth and through the nose. According to the World Health Organization, most people get throat cancer through carcinogens brought about by tobacco. Early detection is vital, as it can swiftly spread to the different parts of the body, such as your lungs and other tissues. What factors can increase your risk of getting throat cancer? How can you better cope with throat cancer? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Alfredo Pontejos Jr., the chairman of the Department of Otolaryngology, Head and Neck Surgery of the University of the Philippines, Philippine General Hospital. Also with us tonight is Dr. William Lim, the head of the Department of Otolaryngology, Head and Neck Surgery at the St. Luke's Medical Center, Global City. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to MedTalk.
Good evening, Angel.
Throat cancer.
Yeah.
What exactly is throat cancer?
Well, yeah, throat cancer, well, as you know, cancer is a proliferation or more growth of cells, okay? There's progression and proliferation of cells. And they are very aggressive in terms of growing. So when you talk of throat cancer, it is actually arising from the vocal cords or from the upper areas, which we call the supraglottis, okay? Or it can be below, okay? And usually the first symptom that it will present with hoarseness. So malat, no? Minamalat yung patient. No? That's the usual one.
It's actually a malignant tumor of the voice box. That's specifically the throat cancer. There are other forms of cancers, but we just take on the more popular one, which is the larynx. It's throat cancer.
You say more popular one. It's among the top
Yeah,
20 killer diseases
yes,
here
among
in
the
the
top
country?
15, yeah.
Oh, top 15.
Yes.
Okay, and because it's among the top 15, cancer is a virus that develops into cancer cells. Is that correct?
There are a lot of causes
Yeah.
of cancer actually. One is the virus, the human papillomavirus could cause the cancer, or some other risk factors like smoking and drinking alcohol.
So, in reference to this area of our physical being,
Yeah.
so our throat, this is our throat, and we have the larynx, the pharynx, our tonsils. Can you please
Yeah.
help us understand it further?
The tonsil is the one that you see when you open your mouth. Okay, that's the one at the back, a couple of structures on the sides. That's what you call the tonsils. And then if you go below, if you have a scope, you go down, you would see the pharynx, the oropharynx. And then down, further down, you have the larynx. Okay, you would see, I don't know, we don't have a picture, but you would see it.
We have a video that's.
Do we have a?
Yes.
Yeah, we
let's
have a video later. Yeah, you would have a structure which is kind of ovoid, which tends to protect the larynx. Okay, this is so that when you swallow, the fluids and the food that you eat doesn't go to the windpipe, okay, and to the lungs. So it will go straight to the esophagus. And then below that, you have the vocal folds. We call it the vocal folds or the vocal cords,
yeah.
which produces sound, and it's also the pathway for air going into the lungs.
So aside from throat cancer or laryngeal cancer, what other types of cancer can develop in this area?
For a lot of things. The hypopharynx, that is the opening through the esophagus, is part of the pharynx, so the throat. That's hypopharyngeal cancer. Tonsils also have cancers.
Yeah.
The base of the tongue, that's the back part of the tongue, would also have cancers.
Yes.
On the neck, you have also the thyroid gland could have cancer. So there are a lot of things that have cancer in our neck, actually.
In our neck. So when one has cancer of the larynx, it doesn't necessarily follow that the others will have cancer cells.
No.
The other parts of your neck will have cancer cells.
Although there is such a thing as
Field cancerization.
yeah, field cancerization. Like if you're a smoker, then all the areas from the mouth down to the esophagus can be affected, and so you can have a cancer in the larynx, and 20% of these patients could have cancer also somewhere else, like the tonsil. I just have a patient right now like that. I did operation on him 10 years ago for larynx, and then 10 years after developed cancer this time in the tonsil.
What, if you don't mind me asking, what brought about 10 years
because of the failed cancerization, meaning the cells in the area where the smoke passes through were sensitized, and so there was a potential any time for cancers to grow again in any area. Yeah.
Actually, all of us has the genes, the oncogene, that could develop into cancer.
So we all
It's just a
have.
matter of change in the immune system that would lead one to develop cancer.
What kind of change in the immune system can lead to one having cancer?
That's a very good question. What's very popular now is the human papillomavirus infection. It's a viral virus, actually, that could alter the genetic composition of cells in our body. Actually, in our body, there's what we call, the cells usually die on their own.
Yeah.
There's a lifespan of cells. But cancer cells, they just produce and produce and produce. So that's cancer.
And you also mentioned, aside from the HPV, you also mentioned smoking.
Yes.
Now we go to the risk factors
Yeah.
of lung
We did a
cancer.
study on that some time
Larynx
ago,
cancer.
and we noted that if we call it by pack years, when we say pack years, so like I say 10 pack years, that means you've been smoking 1 pack a day for 10 years. Okay? Not you, okay?
No.
So it could also be that you have been smoking half a pack a day for 20 years. And we noted that even patients who smoke just half a pack for 20 years can develop cancer. See, so that's rather significant. Because we say most of the time, 1 pack is significant, But in our study, we noted half a pack is already significant.
Wow.
So that's 10 sticks a day. All right. So what are the other factors? Drinking. Drinking alcoholic beverages. Okay, particularly the stronger ones like vodka. Vodka has been strongly implicated in the development of supraglottic cancer, which is in the higher portion of the throat. And
No wonder drinkers sometimes complain the next day that they have a scratchy and itchy throat.
Yes, yes.
Well, there are a lot of factors about that.
Okay.
One could be because of alcohol, it relaxes the esophageal sphincters, causes reflux.
Yeah.
Okay, so reflux is also a risk factor.
Yes, reflux.
Okay. So aside from drinking, what other factors contribute to that
The
reflux? Yes.
Well, caffeine actually. Intake of a lot of coffee,
How
anything
much?
that has caffeine
Okay.
could cause reflux. Stress could cause reflux.
Yes.
Lifestyle.
So these risk factors should be avoided altogether, lessened.
Minimize.
Minimized,
Okay.
yeah.
Okay. For those who smoke, is secondhand smoking also, does it contribute
Yes.
also to one being
Yes.
at risk
Yes,
of
yes.
getting
There are
throat
evidences
cancer?
and studies regarding that. And if you are a second-hand smoker, then you're also at risk of developing malignancies.
Yeah, let us clarify what secondhand smoking
Yes,
is.
please.
So that means that in the house, for example, if you stay with someone, then that other person is smoking well you're not, but just the same, you're able to inhale
Yes.
all the smoke inside your house. So you're at risk of developing cancer also.
How about third-hand smoking? They say third-hand smoking that the smoke sticks to the wall and you are in that area and you breathe and you inhale all that smoke. Does it also contribute?
I'm not very sure about third-hand smoking.
But smoking in general.
Smoking in general.
Yes. Yeah.
How about the symptoms? We were talking earlier in the VTR. We talked about the symptoms: coughing, non-stop coughing,
Okay.
nosebleed, gums bleeding as well. Any
No.
other factors?
When we talk about laryngeal cancer, particular laryngeal cancer, there are three parts of the larynx actually. The upper part is supraglottic, and then the glottic where the vocal fold is, and the subglottic. If you have supraglottic that's above the vocal fold, the symptom will be sore throat.
Okay.
Sore
What is?
throat that doesn't go away, and it's progressive.
Okay.
Or you could also have dysphagia, we call it, like there's difficulty, some discomfort in swallowing, okay, difficulty in swallowing, and of course we talked about hoarseness,
Yes.
and then if it is really big already to the point of obstruction, then you have difficulty of breathing, like in the video. There was one guy
The
who
video was
having difficulty of breathing.
Gasping for breath
Yes,
already.
yes.
The first symptom would be a very noisy breathing, which we call stridor. Stridor.
How does that sound? Like wheezing. Okay. Okay. Just so
Everybody
you
would
are.
remember that.
Okay. So that's one symptom.
Yeah.
That type
it's
of
a
breathing.
late symptom actually.
Yeah.
Okay. But you mentioned also sore throat. Just to touch a little bit on sore throat. What does it mean to have a sore throat in relation to throat cancer?
If the supraglottic, the upper part of the voice box is involved, the symptom is usually sore throat. And the sore throat doesn't go away with antibiotics or anything, and it's progressive. Once you look into the larynx, then you see a mass lesion or buccal.
So you shouldn't take it for granted na akalain mong it's just a regular sore throat.
Yeah.
Particularly if
Especially
it's persistent.
Persistent and doesn't go away.
Okay. So sore throat, the type of breathing that you just demonstrated for us, bleeding in the nose. Why?
No, that's for other cancers.
Oh, that's for other cancers. Okay.
Yes, like nasopharyngeal cancer, which is in the higher up portion or in the nose. You can also have cancer in the nose and the maxillary sinuses. So that's for other things. Now for the mouth, you have bleeding. Sometimes that's for gum cancer.
Okay.
Or something else, okay, and for oral cavity cancers, which we don't want to touch now because
No, we'll just concentrate on,
the voice
on
box.
laryngeal
That's right,
or
that's
voice,
right.
yes,
Yes.
the cancer of the larynx. Also, I saw in the video
Neck
lump,
node.
yeah, a
Lump.
neck node.
Yeah.
Before we go to the break, just a little bit about the neck node.
When you have a neck node and you have a cancer that's going outside of the specific site of cancer, So that means it's going to be an advanced cancer.
That means it has gone somewhere else, it has metastasized.
Okay.
That's what you term metastasis, into the nodes. Okay, so just from the larynx, now it goes to the node, which is actually supposedly a defense mechanism of the body, but they are able to go there. See, so lymphatic spread, we call it.
So when we're sick and we don't feel well, the doctor often touches this
yes.
area
Yes.
We
for the
have
lymph
lymph nodes,
nodes
that's right.
to check if we're well or
Yeah.
we're feeling ill.
The lymph node actually filters the
Yeah.
infection or anything.
But when
So
it's
if
out
the
of place
cancer,
already.
if it's a cancer cell that goes there, that lymph node will grow in yung kulani.
Okay. All right, doctors, we'll talk more about throat cancer. You're watching MedTalk. We'll be back.
Did you know that upon the moment you stop smoking, your risk of having throat cancer decreases? In fact, 15 years after quitting, the risk is reduced up to 70%.
We're back here on MedTalk, still talking about throat cancer. Doctors, we have a caller on the line, John Carlo Dulinaw. Hi, John Carlo. Good evening.
Hi, good evening.
Your question for our doctors, please go ahead.
Okay, so I'm 22 years old. I'm a teacher in a public school, no? And I'm not a smoker. So my question is like this. Usually kasi in the beginning of classes, most especially June and July, so I always experience pain on my tonsils and my throat. So that usually happens after my teaching hours. So I teach for I think 6 hours a day. So I started 6 o'clock and then I ended 12. So that is continuous teaching, no? So na-observe ko after my teaching hours, laging sumasakit yung tonsils and my throat. So my question is talking too much a risk of throat cancer?
Go ahead. Yes, Doc William.
Okay, talking too much doesn't cause throat cancer actually. The symptoms that he feels after talking for 6 hours is actually fatigue.
Or
It's
strain,
it's strain of the muscles of the neck and the voice box. Then the dryness also could cause the pain in the throat actually. So it's the vocal abuse and misuse that cause his problem of throat pain and vocal fatigue.
Okay, so it's vocal fatigue.
Yeah.
Okay.
Kasi may ano kasi po,
Yes.
meron na akong mga uncle and aunties na merong history ng throat cancer. So, ang worry ko kasi, since meron na sa family namin na nagkaroon ng throat cancer, baka may risk din na magkaroon din ako. If lagi na lang na-strain or lagi na lang pagod yung aking vocal cords kapag ka nagtuturo.
Okay, throat cancer is more a lifestyle disease. Okay, so meaning you smoke, you drink, you abuse yourself, you have a risk. I'm not saying all of them will have it, but you have a risk. Teaching is good. So it's not something that you have to worry about as the cause of cancer. But I think, as was mentioned by Dr. Lim, it is more like it's strain, okay? But of course, you said you have relatives that have cancer already. So maybe the better thing is for you to just have a consult. You just have a doctor look at you. So you have a baseline. Chances are you don't have anything, but just have a baseline. Okay. So we have what we call endoscopes, which can look through the vocal folds and see if there's anything there. Yeah.
Giancarlo, any other question?
Sorry, okay na.
Okay na?
Okay.
Okay, so rest your vocal cords.
Yeah, I think so.
And drink warm water, no?
Yeah.
Drink a lot of warm. Maybe you can have water beside you pag nagtuturo ka.
Siguro.
Diba? Okay. Thank you for calling.
Thank you.
You're welcome. So, well, I caught lang June and July. Is it because it's dry also? The weather is dry? Well, June, July is rainy season na rin eh. Does it play a role in the dryness of our throat or the itchiness and scratchiness of our throat?
Our weather is humid, so that should not be a problem. It could be that, like John there, might have a problem like an allergy. We don't know. Maybe that's why it's nice for him to have a checkup, or there's congestion of the nose as to cause the dryness. So he has to have a consult. Yeah.
Not unless all his students are smoking.
Oh no, I hope not. Maybe John can tell us. He has to stay away. But you mentioned he has to get a checkup. What goes on with a checkup when it comes to this area? ENT.
ENT, okay.
Also known as otolaryngology.
Otolaryngology.
Okay.
So when we look into the throat, we use endoscopes, telescopes, where we have this flexible endoscope that can see from the nose down to your voice box. Then if you have hoarseness, persistent hoarseness, we have what we call laryngeal video stroboscopy. It looks into the finer vibration of the vocal fold, and it's very good in diagnosing very early stages of cancer.
Okay.
So the mucosal waves are disturbed with growth or tumors, early tumors. Then we can detect that with the laryngeal video stroboscopy.
Okay.
Of course, we start with good history and physical examination. And then the conventional one, of course, would be the mirrors. We also still use mirrors to look inside, what we call an indirect laryngoscopy. And then if you still would have difficulty looking in the area, that's when you use the scopes.
Okay. So if you suspect that there's something more than what you should see upon checkup. Doctors, how about the misconceptions in understanding throat cancer? You mentioned earlier allergies. Can allergies or postnasal drip lead to cancer of the throat?
No, allergy does not cause cancer, but it can cause frequent. You can have laryngitis, okay? So you can also get hoarse with laryngitis. So it does not lead to cancer. Yeah.
Reflux is now, there's some evidence now that shows reflux could cause cancer of the throat, actually. So the acid from your stomach going up to your throat, which is we call as ENT is laryngopharyngeal reflux, which is different from GERD or gastroesophageal reflux disease.
Yeah.
Okay.
Because our throat or the pharynx is poorly protected from acid, unlike the esophagus, which is resistant to acid irritation. So one episode of acid reflux into your throat could irritate the throat and may cause cancer also.
So just one episode of that?
A day.
A day. So when should you go to your
persistent throat irritation, hoarseness, persistent throat clearing, then you have to examine.
But when you clear your throat sometimes, you don't really feel anything there. Unless like our caller earlier, John, said that it's just dry. So the difference between a dry throat and a throat that needs medical attention.
Then they have to see an ENT.
ENT, right? Or or otolaryngologist right away. Doctors, how about the early detection in throat cancer? We've been talking about that.
Yes.
Just to add to that, we always say that early detection is key. Early detection will prevent the cancer from spreading, and it can take out the cancer cells right away. So what should be done?
The number one symptom is still hoarseness. But of course, hoarseness, it can happen in so many other diseases like inflammations, infections, or even small lesions which are benign. But if your hoarseness persists for at least 3 weeks, meaning it's continuous, progressing, despite medications, better for you to have a checkup, and then the doctor will have a look inside your throat.
Hoarseness in relation to laryngitis, how do we distinguish the two?
Laryngitis is a very short course. 5 days, 1 week goes away. But if it's persistent more than a week to 3 weeks, then you have to be examined down to your throat.
And because our throat is used for swallowing, for breathing, for talking, any changes in that area, we should be aware of it. And we should get in touch with our doctor right away.
The more common laryngeal cancer is the glottic or the vocal folds, which is hoarseness would be the early symptom.
So how? Okay, hoarseness. There are individuals who are who have a naturally hoarse voice.
Yes.
This one is from a speaking voice like this. It goes into a very hoarse and very
more progressive. It's progressive hoarseness, we call it. That means the hoarseness doesn't go away, but it becomes worse.
Okay. Until you're not able to speak anymore.
Then
hopefully it doesn't reach that stage.
That you will always have some other symptoms like obstruction already. So difficulty of breathing and all, if you reach that point.
Okay. Doctors, we have another caller on the line. Vilma. Hi Vilma, good evening.
Hello, good evening. How are you folks?
Good, thank you. Please go ahead with your question.
Yes, I was diagnosed with Graves' disease. It sounds bad as it is. And I now live in the Philippines, a number of months. I'm retired. I lived in the United States all of my life. However, in 2000, when I found out I have Graves' disease, I had particularly, I'm healthy for a 74-year-old woman, I consider myself healthy. However, because of the changes in temperatures, like when I go back home in San Francisco, and it's very cold there, my body temperature drops to like I'm losing my gasp. I'm gasping for breath every time. Then I would go to in warmer climates like Las Vegas, I would automatically lose my voice the next day. So this has been a concern in the last 3 years, because before that, all I had to do was take my Synthroid, the thyroxine tablets that was prescribed to me. And when I came to the Philippines, I skipped the medication. So when I told my doctor, he said, you shouldn't do that because it can cause you like a heart attack or a seizure or something similar to that. So it scared the heck out of me. So now my question is this. Now that I live part of the time here in the Philippines, I have to keep my air conditioning 24/7. I cannot turn it off because it will make me feel like I'm in some kind of a reflex on my body temperature. So what causes that, doctors?
Okay, you have Graves' disease. Graves' disease actually is a problem of the thyroid gland, wherein it produces more hormones.
Thyroid hormones.
Thyroid hormones. And the symptoms is usually weight loss. You feel very, very hot, warm. You perspire a lot. You have tremors. So that's the explanation why she needs the aircon 24 hours a day. But if the Graves' disease is controlled by medication, he should not be experiencing these things.
Yeah, I was just
Okay.
wondering though why you're taking Synthroid.
Synthroid is the opposite.
Because Synthroid is thyroid hormone, and
Right.
that could increase your hypermetabolism. See, so I'm not sure. Maybe you should have a checkup here with an endocrinologist, because normally we give antithyroids for Graves' disease and not thyroid hormone. But yeah, you have heat intolerance because of the Graves' disease. That's why you really have to maintain the temperature in the area you stay. Yeah.
Also, I'm sorry.
Yes.
I did not mean to interrupt. In the event, I almost had I almost went and checked in at the hospital here. I'm close by St. Luke's Hospital. And fortunately, they take my insurance from the United States, which they say they normally don't. But because I have good coverage, I was able to, make a consultation, have a consultation. So usually they say that you would lose weight when you have the thyroid.
Graves'
Yes.
disease, yeah.
However, when I was diagnosed in 2001, it was 2000 actually, I started gaining weight. So
Maybe
I gained
Maybe
weight,
she's
and
hypo.
so finally,
Maybe
when I came to the Philippines, because of I sweat a lot and I perspire and I go swimming and I do my workout, I lost 30 pounds, which is great. So I'm still struggling to lose weight because I'm really, I feel like I'm overweight, I'm bloated, but I'm not. So according to the diagnosis, I should be, that the weight gain was not a problem. However, it has been a problem because I've always been not skinny, but I've always been slender built. I'm 5'4" and I weighed 120 pounds for all my 60 years. Then as soon as I hit 60, 65, I started gaining weight. I went up to almost 200 pounds.
Wow.
unusual for Graves. Yeah.
Yeah.
It's unusual for Graves. Maybe you have to check your numbers like T3, T4, and TSH, because we will know there if you really are hyper or hypo, because your symptoms are a mix of hyper and hypo. So maybe it's really important for you to really have a checkup. At least do the tests first and then see where really you are standing right now, whether you're hyper or you're hypo. Yeah.
Thank you very much, Vilma.
Much for your time, and this is a really an awakening for me because, all this time, and I've been wondering, every time I go back to the States, I always go and have a checkup with my doctor. And he says, you're fine, just do not skip. Don't you ever even think of skipping your medication. So I said, okay, fine. So I told him, please don't scare me to death because I'll die before I can.
Well, thank you very much, Vilma, for your time, for calling, and take care.
Okay.
We'll talk more about tonight's topic, throat cancer, when MedTalk returns.
Everything seemed perfect for Emmer Rojas. He was a successful and healthy radio announcer and telecommunications executive. The world was his playground until he was diagnosed with laryngeal cancer.
Nawalan ako ng boses dahil tinanggal yung vocal cords ko at tinanggal yung vocal cords dahil sa stage 4 laryngeal cancer or throat cancer at ang dahilan nito ay paninigarilyo.
A chain smoker since his teenage years, Emmer's once healthy physique was reduced to just 90 pounds because of chemotherapy.
Nag-umpisa ako ng 17 and I started at the age of 17 with 1 to 2 sticks a day. Lahat naman yata ng mga naninigarilyo nag-umpisa sa isa, dalawa, tatlong stick isang araw. But eventually, nung bago ko maumira, umabot na ng 2 pack a day ang sigarilyo mo. Learn to use this one. Isang assistive device na magbibigay sa akin ng boses. Sa una, nakakainis pag pumunta ka sa mall, sinusundan ka ng mga bata, tinitignan ka ng mga tao, akala mo kung yun nagsasalita kasi hindi familiar.
He also lost his vocal cords in the process.
I got devastated at that time. Lahat tayo, ginagamit natin ang boses. Pagka nawala yung boses, malaking kawalan. Dahil ginagamit mo yan sa negosyo, ginagamit mo yan sa hanap buhay. At it's para ka nabaldado para ka nabulag, para ka nabingi, o para ka naputulan ng paa. Ganon din pala pagka nawala ang boses mo.
But today, when he speaks, everyone listens.
Ang maninigarilyo ay unti-unting lason sa katawan. Hindi ka mamamatay sa isang sismig. Pero sa katagalan ay babawiin ka nito, babawian ka nito.
His robotic voice, an obvious reminder of the negative effects of tobacco use.
I found out that this disadvantage is an advantage for me. Mas yung attention pala ng tao sa akin at ang nangyari, even the advocates, the health advocates notice that iniimbita na nila ako for testimonies of what happened to me dahil powerful daw yung boses ko.
We're back here on MedTalk, still talking about throat cancer. You may join the discussion by calling our hotline at 548-4678. Doctors, let's discuss Emmer's case. He's an announcer, which you really, ito yung puhunan mo, so to speak, your voice. You don't realize the value of your voice.
Not unless it's gone.
Not unless it's gone.
That's right.
Yeah, well, he's a patient of my colleague, Dr. Jose. And yeah, stage 4, so he had to undergo total laryngectomy, meaning the whole voice box has to be removed. So that includes the vocal cords. And then I think they also did neck dissection because there were already nodes that spread to the neck. So that was all cleaned out, and I think he underwent radiotherapy. And so I think he's on his 14th year. He's a survivor.
Wow.
Yeah, he's a survivor. So the thing is, when you remove the vocal cords, when you remove the larynx, the voice box, then you lose your voice. And so there are so many options that can be done for you to recover your voice. One is esophageal speech. So they teach you, instead of the vocal cords, it's now coming from the esophagus. You produce air, and then that air you try to convert into sound. So that's esophageal speech. Now, there are other ways, like other techniques that can be done so you produce voice. Like we put in devices like the Blomsinger, the Provox, that you put, that connects the opening to that of the esophagus, and they produce voice also. Voice are better. But of course, the simplest one is this, the laryngeal voice box. We call it the laryngeal. Electrolarynx. Electrolarynx. So you press it in the area where there would be more vibration, okay, in a muscle where there'll be more vibration, and then that sort of produces the vibration, and then that you try to convert into sound, by the articulators in the mouth, and you're able to produce the voice.
So when you speak with that
Electronic
device,
larynx.
the electronic larynx here, then it produces the words, the sound that you want to convey.
Actually, the electronic larynx takes the place of the larynx, which produces the sound, just the sound. It's the pharynx, the tongue, the palate, which produces the articulation that produces speech.
Which he still has.
Yes.
Yes.
Still has that. Okay.
So it's just a vibrator, resonator that vibrates the tissues in your neck to produce the words.
How about when you eat?
It's the same.
How is that?
No problem
No
with
problem.
eating. He is eating fine. I'm sure he can eat lechon, and lechon baka. I'm sure he can eat
He looks
everything.
very well and
Yes.
healthy from the
What-
before and
yeah.
the
What is not shown with Emer's video is he has an opening
I was
in
about
the
to
neck.
ask. Here.
That's where he breathes now,
Okay.
in the neck.
And is that closed?
No, it's an
you
open
die.
hole.
It's an open hole.
Yeah, you cannot close that.
You can't.
Yeah, because that's
You can get graft. You can get skin graft and
That's
close
the
it.
way. That's the passage for the air, because you bypassed it because you removed the voice box. So now that's where he breathes into the hole. Yeah.
So 14 years
Yes.
since the time he was diagnosed.
He's a survivor. Yeah.
He's a survivor, and will he pass this on to this type of cancer to his children if he does have children?
Not likely,
not
because
genetic.
as long as the children have a healthy lifestyle, they don't smoke, they don't drink, the risk of them developing laryngeal cancer is very small. Yeah.
An alternative to what Emmer is using, you've mentioned something else.
Esophageal speech. Esophageal speech is actually
Is it like therapy?
you swallow air, then you burp air.
Ah,
And
okay.
that would produce the voice. The air that you burp.
Is the voice
voice
that
that-
you will produce?
yeah.
Ah, okay. Is it a choice to get the...
Esophageal speech is quite difficult to learn. But in Japan, that's the primary way of
Yeah.
talking after laryngectomy.
Okay.
Esophageal speech. We're trying to promote it here actually with Emer's group,
Okay.
Laryngectomy Club of the Philippines. Then we have also the electronic larynx, the most popular here in the Philippines. Maybe it's the personality of Filipinos. It's easy.
Yes.
Just put it there, then you talk.
Yes.
The disadvantage of electronic larynx, it's a mechanical voice. So when you talk through the phone, they would put down the phone. Akala nagbibiro ka.
Oh, like gaya ng sabi niya, akala nila nagsasalita ang robot.
Yeah, that's right.
Yeah.
Then another way is to make a connection between the trachea and the esophagus
Okay.
to divert the air from the trachea into the esophagus so that the air would vibrate the tissues in the pharynx to produce speech.
Okay, so there are many alternatives.
Many,
It
yes.
depends also on the type of person.
Yeah.
No, if basta you're able to speak, you're
right.
able to communicate and convey your message, no, whatever manner you choose after the diagnosis and the operation. Is there a chance for it to recur
With him?
with
Emmer?
him
Emmer is 14 years, so...
and others?
Yeah,
And others.
well, there is a risk of recurrence, like him, very advanced cancer. Most of the time, 40%, meaning 4 out of 10 would be alive in 5 years.
Okay.
The rest would not survive. Okay, so that's for stage 4. For earlier stages, of course, it's higher. You have 8 out of 10 who would be surviving. So those are their chances. So Emmer is a bit blessed because
Yes.
he survived. you
And
know.
it was stage 4 already.
Yes, it's a very advanced stage.
Malalang
Yes.
stage na.
That's right.
Hopefully, others don't make it reach that stage na you've
Yes.
detected early
That's why early
on.
detection is very important.
Yeah, that's the trust of our society right now.
Yes.
Early detection for head and neck cancer.
Yes.
For early detection for laryngeal cancer, then you can spare the larynx actually.
You can preserve the larynx still. But like what we said, Emmer is blessed and he continues to bless others with his
Yes.
story.
That's right.
Doctors will talk more about throat cancer when MedTalk returns.
Did you know that the heavier you are, the more prone you are in getting throat cancer? According to the Throat Cancer Foundation, if your body mass index or BMI is above the suggested limit, you will be at risk of developing this type of cancer.
We're back here on MedTalk, still talking about throat cancer. Doctors, this time we have another caller on the line, Mike. Hi, Mike. Good evening.
Yes, ma'am. Good evening.
Yung question mo para sa mga doctors natin?
Oo. Ma'am, I would like to ask our doctor. I was operated at left side, and it turned out to be biopsy resulted to squamous cell carcinoma.
Okay. Mike, Mike, sorry, I don't mean to cut, pero parang napuputol-putol yung parang choppy ka. Can you please repeat lang, if you don't mind? Salamat.
Now.
Okay.
Last year, in October, I was operated from with a lateral neck mass. And they were able to extract mass from a lymph node on that mass and from the stem cells left side. And after the biopsy, it turned to be squamous cell carcinoma, vascular type. My worry up to now is tingling sensation ringing from my ear. I didn't worry about that because I thought na mawawala lang.
Malinaw.
But up to now, it's almost this year already. Ay nawawala yung ringing sensation doon sa tainga ko. So ang worry ko baka when will
Okay. Mike, sorry, yung last part lang, medyo choppy ka ulit. Pwedeng pa-repeat lang please yung last question.
Opo.
Salamat.
Ang question ko, ma'am, kung up to now, nararamdaman ko pa rin yung parang mga ringing sensation sa both ears.
Okay. Oo. Salamat, Mike.
Mike, we have to clarify things. You had a neck node, lateral neck node, which was operated on, and it was seen to have squamous cell carcinoma.
Wala na. Okay. Maybe he's just watching na lang. He's not on the line.
What I got was he had a tonsillar cancer with a node. So maybe he had treatment, maybe chemotherapy and radiotherapy.
Okay.
Now, radiotherapy sometimes, because it's in the area, can hit some normal structures, and the ear is close by, and so there might be, I'm not saying it is,
Yes.
but there might be some problems now related to radiation because it's close by when they have radiated him. So it's important for him to have a check and see what the ear status is so we would know how to treat him.
Okay. Dr. William, would you like to? No more. Okay. Ringing sensation in his ear.
Yes,
Yun
ringing
yung
sensation.
pinaka-complaint niya.
Yes, we do get that once in a while with our nasopharyngeal carcinoma, because nasopharyngeal is just behind the nose. And when you do radiotherapy, they do hit this certain areas here.
Oh, okay.
So, and same is true with the tonsil. So that might be the reason.
Okay. Well, thank you for calling, Mike, and thank you for that, doctors. I also understand that it is Head and Neck Cancer Week.
Oh, yes.
Timing that you're here on MedTalk.
Yeah,
Please
I
talk
have
about
a
that.
código here. We have the,
Yes.
we call it the Handakaw. Handakaw is Head and Neck Cancer Consciousness and Awareness Week, which was actually, we had a proclamation, presidential proclamation, in fact.
Yes, doctor, go ahead.
1676, declaring that the last week of April is Head and Neck Consciousness Week. So now, since yesterday up to Sunday, we have a lot of activities. We just had what we call Pasilipka.
Okay.
When you say Pasilipka, you know, or you go to your doctors. These are for free, and the doctor will have a look at you, look at the nose, look at the throat, for free. I mean, you know, if the doctor is a volunteer.
Yes.
Okay. But that actually started yesterday. I'm not sure if there are some others. Some hospitals still post it out, and they have free consultations. And then just this morning, we had inter-hospital grand rounds in Medical City, where we discussed very difficult cases and tried to come up with solutions to them. And then we have all of this radio programs and television programs. Yes. And then we also have nasopharyngeal cancer discussion on Friday. And then this will culminate in Takbo Laban sa Cancer. Isang Takbo Laban sa Cancer. So if you're free on Sunday,
this Sunday,
circle, what do you call this? Quezon City Circle.
Okay.
You just go one round, you know.
Okay.
This is run for Laban sa Cancer. That will culminate the whole activity for the week. Yeah.
Okay.
This is really to make people aware that head and neck cancer is not something rare or ano ba yan, no? If you combine all of these cancers, we will rank number 3 of all the cancers.
Oh my!
Yes, because you know you have cancers from the throat, the nose,
yes,
the tonsils, the tongue, and everything. If you combine all of them, we will rank number 3.
Okay, so we do not want to rank number 3 in this type of cancer.
Right.
So we have
to
this.
Be aware,
yes, and in spreading awareness, how else can we educate our viewers on staying away from all the risk factors that can lead to throat cancer?
The best thing is really a healthy lifestyle, healthy living. I think good food, you do exercise, and you sleep 8 hours a day, and you don't have vices. You don't drink, you don't smoke. Okay, you avoid those fatty foods. Okay, so eat vegetables and fruits. I think a healthy lifestyle, because majority of our cancers, of course, short of those that are secondary to viruses, are really related to lifestyle.
Lifestyle, healthy lifestyle.
That's right.
Yes, Doc William?
In moderation, do things in moderation.
Okay.
Not too much alcohol, not too much smoking, not too much of everything.
Not too much fatty food as well. Everything in moderation.
It's a very sad life. You don't have these things.
Yes, we want to be happy and we want to be able to enjoy all of that, but in moderation.
In moderation.
And just like because it's Head and Neck Cancer Week, pasilip ka. Get your checkup.
Yes.
How often should we get our checkup before we go, doctor?
Yeah. Maybe, well, we don't have yet this standard of having a checkup once a year, but maybe the nasopharynx, I think, should be checked at least once a year.
Once a year.
Because nasopharyngeal cancer is actually ranked in the top 10, number 9.
Especially among Asians.
Yes, among Asians.
Maybe we can talk about
this is what we have in common with China. You know, nasopharyngeal cancer. Yeah.
Okay, maybe next time here on the show we can talk about that.
Yes, and also the thyroid, of course, is ranked number 7.
Yes.
So those two are in the top 10.
So head and neck, take good care of your head and neck.
Yeah.
Everything in moderation.
Yeah.
Pasilip ka.
That's
Because
right.
ENT mo, so that you know you're aware of the activity going on in this area. And thank you for helping us understand this more.
Yes.
Thank you for the advice and the on-air consultation that you gave to all our callers. Maraming salamat ulit, Doc William and Doc Alfie.
Yes, thank you, Angel. Yeah.
See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. I'm Angel Jacob. Good night.